Teresa Freed with Johnson County Government. It's our goal to stop the spread of COVID-19 in our community. We also want to make sure you have the latest information on our efforts. For data on how COVID-19 is impacting the county, visit our dashboard on jocogov.org.
Hi, I'm Dr. Joe LeMaster, Local Health Officer for Johnson County. Today we want to talk a little bit more about where we are in the pandemic right now. We're about 2 weeks after Christmas, and as we predicted and anticipated, we're starting to see a jump up again now in new cases that are starting to get diagnosed. The numbers going up to the same level that they were before Christmas and even higher. This is looking very much like what we were seeing after Thanksgiving and after Halloween. What's happening now, though, that continues to be a problem is that with these increased numbers, we're seeing more people who are getting hospitalized and staying in hospital a longer period of time. So the number of hospital beds that are available, especially ICU beds, continues to be at a critically low level. We still are seeing more use of those ICU beds than ever before. We also are seeing more deaths in Johnson County. We've just surpassed 500 deaths in Johnson County. The number of deaths that we had one recent week was more than 40 deaths in a week. This is really a very high level, and so we want to continue to emphasize the importance of all of the social distancing methods that we've talked about before, maintaining that 6 foot of distance between you and another person, wearing masks if in any kind of an indoor setting, and washing your hands frequently and before you eat or touch your face. Some people are saying, well, now that the vaccine is here, as soon as we get all of the healthcare staff vaccinated, then that will take care of the healthcare bed shortages, won't it? Well, no, it won't, because we're still seeing that number going up even faster with this new variant, which we know is present in the states around us, and so almost certainly is present here. That new variant increases the transmission of the virus, so the higher the transmission is, the more we'll see numbers. The higher the numbers of cases, the higher the numbers of hospitalizations and deaths will happen. We won't start to see any kind of effect on our overall hospitalization rates or deaths until we can get closer to that herd immunity rate. So vaccination is going to be our key, but it's going to take us a while. Right now we're still in phase 1. We're still vaccinating healthcare staff in Johnson County. We've got a lot of staff still waiting to get vaccinated. Vaccine supply is still the thing that we're struggling with. We're nowhere near being ready to go on to phase 2 because of vaccine supply. So even if we get all of phase 1 done, as soon as that's done, we'll move on to the next phases, but it will still be quite a while before we get to herd immunity. So it's extremely important that we not let down our guard now so near the end. In particular, we urge you to continue to follow the social distancing guidelines that we've given all along with respect to wearing masks. We're also starting to see some persistence or some increase in people in small gatherings outside of healthcare settings or businesses in the community where people are gathering for informal or gatherings in churches, in high school gatherings, in other types of parties where people are not wearing masks and not practicing social distancing. With the new variant coming in, we're likely to see more transmission happen as a result of that kind of behavior happening. So we would strongly encourage you now more than ever to be vigilant with respect to the social distancing that we've talked about before.
For more information about COVID-19 in Johnson County, visit jocogov.org/coronavirus. You can also subscribe to a daily e-newsletter with the latest data and precautions being taken in the county and state.